everyone, and welcome back to my channel. So today we are going to dive right in and make this a very quick video. So let's talk about, what do you actually know about burning after sex? That is the topic for today. We want to know why we burn after sex, especially women. Okay, so a burning sensation after sex is a type of dyspareunia, or a painful sex. So it can occur due to lack of lubrication and also severe friction, or if you have STI, causes of burning after sex. Okay, so for example, switching positions and adding more lubrication and also communication can also help ease the pain during after sex. People of all sexes and genders can experience pain after sex. There are several reasons why it can develop, and here are the most common reasons why it can, increase, the pain can increase. So number one, guys, the shape of the shape of your partner's genitals could irritate someone's skin, and obviously cause burning sensation as well. That's another reason why you could be experiencing burning sensations. The other one is also allergies and skin irritations as well. The allergies, if you're allergic to latex, lubricants, lotions or perfumes may also irritate the genitals as well. So friction may also be a factor to that, especially when there is not enough lubrication as well. Sexually transmitted disease or infection, I should say, is another thing that causes irritation. So things like gonorrhea, things like that may cause burning during and after intercourse as well. Like I said before, lack of lubrication, when there is inadequate lubrication, sex can be very painful as well for both of you. So the pain tends to be worse in the female and may cause burning after sex. Psychological and relationship factors that can also affect. Some people experience pain during and after sex because of anxiety and obviously distress about sex, the relationship, or past sexual experiences. Sometimes psychological stress may cause a person to unconsciously tense up and make sex pretty uncomfortable. The other thing is rough sex. Now, rough sex, especially without lubrication, can irritate the skin. Sexual position can also be a factor as well. So you've got some positions may irritate the skin and cause pain. Others may intensify the pain of other conditions as well. So for example, positions that allow deep penetration, for example, can stimulate the cervix and can be painful. So in a female who has cervicitis, the pain may be worse after sex. Cervicitis, yeah. So we've got infections as well. Various infections can cause burning or pain. This can include prostatitis in male, UTI, urinary tract infection, or yeast infections as well. These are all can cause, these are bacterial infections that can cause pain. Now, what do you do to prevent this? What you need to do to prevent this is switching positions. That's supposed to help. People can track what types of sex and positions that can cause burning. So obviously while you're doing it, make sure you check what positions work for you, what positions are irritating you and causing pain or friction from a specific position. So if your intercourse is painful, then people usually prefer to focus more on the oral sex as well. Try and use more lubrication as well. That's another thing. Dryness increases friction, so that place has to be kind of more moist, which can irritate the skin. So when it's dry, it can irritate the skin. So make sure that it's wet. And if the burning sensation occurs after using a specific lubricant, a person can obviously switch to another product as well. Communicating, some people feel uncomfortable expressing their sexual wishes or talking about sexual pain and things like that. But what you have to remember is that open communication is very, very good. It makes it easier to experiment and find what works, because some couples find help from sex or couples counseling as well. That also helps. Practicing safer sex as well may reduce the risk of getting sexually transmitted disease. Switching to latest free condoms as well. People may wish to use condoms that do not contain spermicide, as someone could have a spermicide allergy. Now you've got considering a physical therapy. Some injuries to the genitals, especially the vagina, especially if you've had a tear down below after giving birth, that may cause a chronic pain. So what you need to do is do pelvic floor exercise to try and, track that back together. You can use cold compress as well to, or an ice pack to alleviate the pain. That also sometimes help. So let's talk about the males. What causes? Several reasons can cause males to experience a burning sensation, and one of them is perineal infections. So prostatitis, for example, prostatitis, for example, is an inflammation of the prostate. The acute form of this condition usually appears suddenly. So due to an infection, some males with prostatitis experience burning during or after sex, or burning when they ejaculate or urinate. The chronic form of prostatitis develops slowly over time, and it may come and go, or get steadily worse. Males with this condition can find it painful or difficult to urinate. Both types of prostatitis are treatable. So it is also possible for yeast infection to affect males. It's not just the women. So they may experience an itching or burning sensation on the penis itself. Antifungal medication usually helps resolve this infection as well. If someone has had injuries to the penis as well, it can cause painful sex as well, or maybe like cuts and scrapes and stuff can irritate the skin. Bruising and things like that can irritate the skin. For women, we have the vaginal infections, like the yeast infections that we talked about, the bacterial infections that we spoke about, that causes pain down there as well. Lubrication issues. So menopause, for example, that area gets pretty dry, and that's when you need extra lubrication. Sometimes when you're having prolonged sex, causes the female's body to stop producing lubrication. So there again, you need more lubrication for that. Hormonal changes linked to giving birth. Sometimes anxiety about sex or the relationship, and certain medications as well can actually cause dryness in the area. Vaginal injuries as well, postpartum period, like after you've had a baby, there's injuries down below that can cause, be a reason for the painful sex as well. So when to see a doctor? If you experience all this pain, which is unbearable, chronic pain, not just after sex, the pain gets worse and you have symptoms with it like fever and things like that, do see your general practitioner, a healthcare, and they will advise you what to do. So I hope you guys, I hope that helped you guys, and I'm going to see you in the next video. Take care.